Let us start with third layer muscles. So the third layer muscles are flexor hallucis brevis. So you can see here this is the flexor hallucis brevis, especially goes to great toe, and it's a small muscle and it's a flexor. So second muscle is adductor hallucis. So this is also hallucis which goes to your great toe, but it's an adductor. And next comes the flexor digiti minimi brevis. So flexor digiti minimi brevis, which will go to your little toe, and it is in flexor. So in the case of third layer, you will see two flexors and one adductor. So till now in the layers of our sole, we didn't see any adductor, we saw only abductors. If you remember, in the first layer you will have two abductors and one flexor. In the second layer it's opposite, you will have two flexors and one abductor. In the third layer you have different that in third layer you have one adductor and you have two flexors, right? So these are the three muscles of our third layer. So let's start with our first muscle, that is the flexor hallucis brevis. So this is covering the plantar surface of first metatarsal bone, and it arises by a Y-shaped tendon. You can see here the Y-shaped tendon, and also from lateral limb from medial part of plantar surface of cuboid bone behind the groove of peroneus longus. Actually it is arising from cuboid bone on medial side, and also it is coming behind groove of peroneus longus and from adjacent side of lateral cuneiform bone. So it is also coming from lateral cuneiform bone and from cuboid bone. So it is from medial limb is direct continuation of tendon of tibialis posterior. Actually this flexor hallucis brevis is direct continuation of tibialis posterior muscle. Okay, so now this will go and insert into the medial and lateral parts of each ends in a tendon. Actually this flexor hallucis brevis will divide into split into medial and lateral parts, and they will end in a tendon, and each tendon is inserted into corresponding side of base of proximal phalanx. So to the proximal phalanx base, here you can see on the sides it is attached to the sides. So this is our flexor hallucis brevis, especially attached to base of proximal phalanx of grade 2. So the nerve supply is of course the medial plantar nerve because it's on the medial side. The actions are, it flexes the proximal phalanx at metatarsophalangeal joint of grade 2. So for example you can see here this one like this. This is the proximal, this is the distal joint, right? So this one like this one is called the flexion of our grade 2, and it is done by our flexor hallucis brevis. So next coming to our adductor hallucis. So this adductor hallucis, you can see this muscle. So this is arising from the two heads, one is oblique head and one is a transverse head. So this is oblique head, this is transverse head. So the oblique head is large, arising from base of second, third, fourth metatarsals from the sheet of tendon of peroneus longus, here this one, right? And the transverse head is small, and it arises from deep metatarsal ligament and from plantar ligaments of metatarsophalangeal joints of third, fourth, third, fourth, and they're coming in reverse order. So it is coming from deep metatarsal ligament and joints at third and fourth, fifth toes. So third, fourth, fifth toes. So from this it will come, and it has no bony origin. Okay, so this is the origin of this two heads of adductor hallucis. One is transverse head and one is the oblique head. So this will go and attach to the lateral side of base of proximal phalanx of big toe. So here they will attach, which is in common with lateral tendon of flexor hallucis brevis. You can see here the flexor hallucis brevis tendon and these two heads of adductor hallucis tendon, they all attach to laterals on the lateral side of proximal phalanx base. Okay, so this is supplied by deep branch of course lateral plantar nerve, which terminates this muscle because this is on medial side. So this flexor hallucis brevis is supplied by medial plantar nerve. As this adductor hallucis is on lateral side, it is supplied by lateral plantar nerve. Okay. So what is the function of this adductor hallucis? It does adduction of grade 2 towards the side of second toe. Adduction means bringing near, right? So like this. This function is by our Adductor Hallucis, and it also maintains the transverse arches of the foot. So next we'll move with the Flexor Digiti Minimi Brevis. So this one is Flexor Digiti Minimi Brevis. It is lying along 5th metatarsal bone. It is arising from base of 5th metatarsal bone and from sheet of tendon of peroneus longus. So from here it will go and insert to the lateral side of base of proximal phalanx of little toe here. This is the proximal phalanx, this is the distal phalanx. So to the proximal phalanx base it will insert. So it is supplied by, of course, the lateral plantar nerve, and it's by the superficial branch. So the main function of this is it flexes the proximal phalanx at the metatarsophalangeal joint of little toe here. So like this, little toe, this function from side you can see like this, here, over here, this flexion is done by our Flexor Digiti Minimi Brevis. So by this we completed the muscles of third layer. Next, just we need to discuss the muscle of fourth layer. What are the muscles of fourth layer? Let us see. You can see here layer 4, plantar view and dorsal view. So for the fourth layer we no need to discuss any origin and insertion. They are nothing but our plantar interossei and dorsal interosseous muscle. Along with this, there is also tibialis posterior and peroneus longus muscles tendons are present. So we'll also discuss interossei in this video itself. So if you see these interosseous muscles, there are very small muscles. They are present in between the metatarsal bones. You can see here, these are the metatarsals, right? These are the phalanges. So in between the metatarsal bones, you have palmar interossei in the case of palmar surface and dorsal interossei in the case of dorsum of foot, right? So dorsal means, according to our leg, this is the dorsal, this is the plantar surface, or also called as sole surface, right? Where we place our leg, that is called as sole surface. So sole surface is plantar surface where you have plantar interossei, and on dorsum of foot you have the dorsal interossei. So this is the fourth muscle layer. So each plantar interossei are arising from plantar surface on shaft of one metatarsal bone, and it is inserted into base of proximal phalanx. If you see its insertion, it is inserted into base of proximal phalanx, okay, and also into the dorsal digital expansion. So this plantar interossei will go and insert into the dorsal digital expansion, right, of corresponding digit. And each dorsal interosseous muscle, they arise from shaft of two adjoining metatarsal bones, and they are inserted into base of proximal phalanges. So same like here, you can see they are inserting into the base of proximal phalanges and into dorsal digital expansion. So either plantar interossei or dorsal interossei, both will go and insert into the dorsal digital expansion. And details of attachment, the interossei adduct or abduct the toes with reference to axis passing through second digit. So always remember the second digit. According to the second digit, we will see its movements. We'll understand it now. So plantar interossei are merely adductors of the third. You can see this is the first one, second, third. So plantar interossei are adductors of third, fourth and fifth toes, okay, especially third, fourth and fifth toes, especially their what they are saying, adduction. So how to remember that plantar interossei do adduction? Just remember the word dab and pad. So pad for plantar interossei, they do adduction, okay. So the dorsal interossei are abductors. So can remember dab, the word dab. Dorsal interossei are abductors. The first dorsal interosseous muscle is inserted into the medial side of proximal phalanx of second digit. You can see here, to the second digit it will go and insert. And the second muscle into the lateral side of proximal phalanx of second digit. Whereas if you see the third dorsal interossei, it will go and insert into the proximal phalanx base of third digit. Fourth interossei into the proximal phalanx of base of fourth digit, right? But in the case of second interossei, dorsal interossei, you need to remember that it will go and insert into the second proximal phalanx base only. First one will insert into the second interossei. So according to the second one, you need to remember this dorsal interosseous. And so also note that the movement of second digit to either the medial or lateral side constitutes abduction. So the second digit, it will move this side or this side, then it is called as abduction. Abduction means always going away, right, like this. This interosseous muscle don't only have not only have the abduction adduction, they also mainly flex the metatarsophalangeal joints. That is, like you can see here, metatarsophalangeal joints means like this. So like this one, this flexion is done by this interossei, and also they will do the extension of interphalangeal joints like this. So these two functions are done by our this interosseous, and like the lumbricals, they maintain the extension of digits at interphalangeal joints, while tendons of flexor digitorum longus flex the metatarsophalangeal joints, so that in walking and running the toes don't buckle under. So as the toes may buckle under, so to prevent that, they'll be extended like this, so you can walk properly. So mainly this interossei are useful for abduction and adduction. So remember that plantar interossei, always the word pad means adduction, ad. Okay, adduction means bring these fingers nearer. So for example, in the case of your upper limb, adduction means like this middle finger is a our point, so towards this middle finger the fingers are coming, so this is adduction, right, ad. Whereas dab means dorsal interossei, they do abduction, means towards the middle finger they'll deviate the fingers away from this. So the same will apply even for your leg, especially to this. You can see here, this middle finger is the center of point, so if these fingers are moving away, these three fingers move away from this finger, then that is abduction, and this finger moving away, that is abduction. If they are coming towards this finger, that is adduction. So this plantar interossei will move these three fingers towards this center finger, so that is adduction. This is abduction. Okay, so that is a function of plantar and dorsal interossei. By this we completed all the 4 layers of our muscles of sole. Next we'll start with plantar vessels and nerve. We have different vessels and nerves to discuss in our upcoming videos.